What is anxiety? A guide to manage anxiety and stop worrying. Have you ever experienced the symptoms of anxiety, but for no apparent reason? Maybe you're in the grocery store and suddenly you start to feel the telltale signs: sweaty palms, a lump in your throat, and a feeling of impending doom. It feels like something's wrong, but you can't think of a good reason for feeling the way you do. If this sounds familiar, you might have generalized anxiety disorder. Hi, I'm David Yadush, LPCC, a licensed therapist with BetterHelp. Today, I'm talking about one of the most common types of anxiety disorders, generalized anxiety disorder, or GAD for short. Let's dive in. What is generalized anxiety disorder? So, what is generalized anxiety disorder? This common anxiety disorder is characterized by a persistent sense of worry or dread that appears to have no specific cause. Anxiety symptoms associated with GAD are excessive enough that they interfere with daily activities. In some cases, an initial spike of anxiety can begin a spiral of ruminating, focused on trying to figure out the source of the anxiety. Many times, people with this disorder are constantly preoccupied by the feeling that something is terribly wrong. What are the symptoms of GAD? Now, let's talk about some of the other symptoms of generalized anxiety disorder. If you have GAD, you might also experience persistent worry or feelings of dread, restlessness, hypervigilance, trouble making decisions, difficulty concentrating, suicidal thoughts, irritability, headaches, sweating, trembling, muscle tension, fatigue, trouble sleeping, irritable bowel syndrome, and unexplained chest or stomach pain. What causes GAD? If you're experiencing symptoms like these, you might wonder what's causing these feelings. It's a valid question, and the answer is there might be several different reasons. Researchers haven't identified a single cause of GAD. Instead, they've pinpointed a list of risk factors that could make people vulnerable to the disorder. Family history. If there's a history of anxiety in the family, you may have a higher risk of developing GAD or another anxiety disorder. Gender assigned at birth. People assigned female at birth are twice as likely to develop GAD in their lifetimes. Personality. Certain personality traits could make you more vulnerable for GAD, including perfectionism and pessimism. Brain chemistry. Brain structure and neurotransmitter activity may play a role. Environmental factors. Being exposed to stressful or traumatic situations could lead to GAD. Have you reached the point of information overload? It's okay to pause the video and breathe. I know this is a lot to take in. In the meantime, leave a comment down below about your experience with anxiety, including any tips you can share for others going through the same thing. And don't forget to subscribe and enable notifications while you're there to keep receiving helpful content like this. Why is a GAD diagnosis helpful? If you think you might have generalized anxiety disorder, I encourage you to get an evaluation by a mental health professional. There are many quizzes and self-assessments you can take online, and some of them are okay, but they can't replace an official diagnosis of GAD. Why do you need a diagnosis? You might think it's just an unnecessary label, but the truth is, it can open the door to treatment and relief. What are treatment methods for generalized anxiety disorder? I want to go over some of the options you'll have if you do receive a diagnosis of GAD. Medication. Depending on how severe your anxiety is, your provider might recommend medication. Not everyone with anxiety needs medication to manage symptoms, but some do. Keep in mind that a therapist can't prescribe medications, but they can refer you to a doctor or psychiatrist who can. Therapy. One of the most effective treatments for anxiety is therapy with a licensed and compassionate mental health professional. A therapist can work with you to build a treatment plan that supports your goals, like grocery shopping without anxiety. There are different therapeutic approaches to therapy, but cognitive behavioral therapy, or CBT, is also one of the most common because it's high success rate. Online therapy. Some people used to question the validity of online therapy, but after a lot of research, experts have now embraced it as a legitimate and effective treatment. Online therapy is becoming increasingly popular because of its convenience and affordability. Studies have found that online CBT in particular is an effective method for treating generalized anxiety disorder. What can I do on my own to manage GAD? Alongside therapy and possibly medication, there are also some things you can do on your own to relieve some of the symptoms of GAD. These include meditation and other relaxation techniques. Think deep breathing, guided imagery, or progressive muscle relaxation. Having interpersonal support. Support from family and friends can go a long way, whether you're sharing details about your anxiety or just spending time together. Lifestyle changes. These are things like diet, exercise, sleep, and stress management that might seem simple, but can make a big difference. Anxiety can be hard to deal with, but support is available in various forms. Make sure you take advantage of it. And don't forget to subscribe to the BetterHelp channel for more mental health tips and to learn more about coping with anxiety. Until next time, take care.